I'm Adrienne Carmack, urologist with Integrative Health Matters, and in this video I'd like to talk with you about a promising treatment for recurring urinary tract infections. As a urologist, this is one of the more common problems that we see, and it can be one of the more difficult ones to treat. So a urinary tract infection is when you get a bacterial infection in the bladder. You'll have symptoms of pain with urination, frequency, burning, often blood in the urine. And what happens often is that a woman will continue to get recurring infections. So one will clear up and then she'll get another one very soon thereafter. This happens probably because the first infection damages the lining of the bladder, and that weakens your defenses to a subsequent infection. So women do frequently get bacteria into their urine because the urethra is so short, and it's normal to have bacteria around the opening of the urethra. But normally, if our defenses are strong, those bacteria aren't able to create an infection. When those defenses are weakened for whatever reason, be it a nutritional issue or stress or a prior urinary tract infection that damaged the lining of the bladder, then we get set up to have recurring infections. And it can be very difficult to clear them. It often requires at least 6 months of either low-dose antibiotic therapy or herbal antimicrobial therapy. So this is a really exciting article that talks about a new treatment. This is a research study that was performed in 2019, or published in 2019 from a group in Iran. And they basically did a placebo-controlled, double-blind, randomized controlled trial on 30 women who had a history of having at least 4 urinary tract infections a year, which is quite significant. And they used platelet-rich plasma in these women. So platelet-rich plasma is when we draw your own blood, we spin it down to concentrate the platelets, and then we put those platelets to an area that we want to heal. Platelets are the part of your blood that heals cuts and other wounds, and so by directing those platelets, we force growth factors to be released in the area where we want them to. And in multiple fields of medicine, platelet-rich plasma has been shown to stimulate healing and to be very safe because it's coming from your own body. So they took 30 women, and 15 of them got platelet-rich plasma, and 15 of them did not. Nobody knew who got what. They went in once a week, and the procedure was a simple installation. So they would have their blood drawn, have the platelets concentrated and mixed in with some normal saline. Then they would put a little bit of numbing gel in the urethra and inserted a very tiny catheter, which should have been not uncomfortable at all or only minimally. And then they instilled the small amount of fluid and had the patients hold it for 2 hours. And they would rotate every 30 minutes from their side to their back to their other side to their abdomen so that the whole bladder got covered. And then after 2 hours, they would urinate. And they did this once a week for 4 weeks. The authors followed the patients up with questionnaires about their urinary symptoms and with urine cultures. And they followed them up 2 months after the treatment and 1 year later. So of primary importance is that there were no adverse events reported. That's extremely critical. This is first do no harm medicine, a very important ethical principle when considering novel, non-FDA approved therapies. So they found that in 2 months, there was a significant improvement in their score on the urinary symptom questionnaire. So those who had just gotten saline, their scores were dramatically different here. They also found the rates of urinary tract infections. Those who just got saline still got 4 per year, and the ones who got the platelet-rich plasma only had 1 per year. Very dramatic difference. So clearly this helped them. Very importantly, like I said, there were no side effects. And from a scientific standpoint, it just makes sense. If we can just get your bladder lining to heal, then you're going to have more resistance to infections and be able to experience this better quality of life. We are offering this therapy at Integrative Health Matters. We're experienced with platelet-rich plasma, and I am a board-certified urologist. We would love to chat with you and see if this may be an option. Please call us if you're interested. Thanks.